Hey, we're back with Urgent Care Management Monthly, Dr. Tim Reynolds, and with me I have Joanne Wright.
Right.
Right? Right. That's only funny because she just got married this last week. How was that?
It was great.
Where did you get married?
In Las Vegas.
But where did you finally do it?
The Little White Chapel.
You went to the Little White.
In the drive-thru.
No, you didn't.
Yes, I did.
You got married in the drive-thru.
Yeah, I know, right?
That is awesome. So, that's cool.
Yeah.
And Joanne is our charge nurse over all of our nursing in our company. And tell us a little bit about yourself.
I was just the floor nurse for 2.5 years before I became the charge nurse at Healthcare Express. Actually a new nurse coming on into the field when I started at Healthcare Express, and
Now look at you.
I know, I started 6 months ago as a charge nurse.
You all growed up.
I all grown up.
And she's doing an outstanding, amazing job. Really, that's
Thank you.
absolutely true. So let's talk a little bit. So outside Healthcare Express, you're now married.
Mm-hmm.
You have children.
Mm-hmm.
How many children?
3.
How old are they?
14, 10, and 5.
And none of them came out of you.
No,
So you adopted 3, or you inherited 3.
I did.
How's that?
It's good.
Yeah, it's all good. Life is wonderful
Life is wonderful.
and busy.
Yes, very
So
busy.
suddenly you have
Yes.
a family. That's cool.
Instant mom.
All right, so let's talk about Healthcare Express a little bit. Today we're going to talk about narcotics, which is a touchy subject in
Right.
medicine in general, and particularly a touchy subject in urgent care. So tell us a little bit about our narcotics policy and how that's where we're at with that.
Basically, the policy is pretty much, I mean, I guess, like any other clinic, you have to follow the DEA guidelines.
What is that?
Um,
For someone who doesn't know, just kind of the basics of, could you have to keep it locked up? What is the
right.
idea?
Basics on keeping your narcotics, it's a lockbox with 2 locks. The key is secured with, whether it be the nurse or the doctor giving the medicines. Whoever's giving the medicines keeps the key secure at all times. That box is located inside a room with a lock on the door.
So double lock, inside a lock, inside a locked room.
Preferably in a low traffic area. You don't want, all kinds of people coming in and out with, it's a high liability.
Interesting. To be honest with you, I didn't even know that. So I guess I knew it at one point because we built the building,
Right.
So why is that important for an urgent care center?
I mean, you have to stay within DEA guidelines. I mean, you want to stay in good standing, or you won't have a clinic, pretty much, or you won't have narcotics in your clinic. Exactly.
Right. Okay. So pretty much, is this a federal law, or do different states have different laws?
Different states have different laws, but pretty much the locking standards is pretty much federal. The way you order medicines are different. Different states have different laws.
Ordering standards and stuff. And so, what is the ordering standard? So, like in the state of Texas, for example, how do we order narcotics?
For ordering narcotics in Texas, Schedule 3s are just like any other medicines. You order them the Schedule 2 and above. Schedule 2 actually are the only ones we order, but you fill what's called triplicate under the physician's name that has the unrestricted DEA. One physician per clinic is
designated.
Right, exactly.
And I'm that for one of our
You are.
clinics because that's the lowest form
Right.
one that says, yeah, we're going to send that out. And then we have another doctor for our other
Right,
clinics that
right.
does it. Okay, good, wonderful. And so now I'm a doctor, I'm working, I order a shot of Demerol. What is sort of the procedure that has to be followed in order to make that happen?
The nurse or whoever was giving the medicine at that clinic has held the keys. You have to go through a logbook. You document the patient's name, the date of birth, the medicine, the dose given. The provider, physician that ordered the medicine is logged, and then the person giving the medicine signs off on it.
Good. And kind of explain for those who've never done this before, they're setting up their program, what we do at the end of shift and all that, how that happens.
At the end of the shift or at shift change, you'd be the two nurses, licensed personnel have to count narcotics and sign off on it. And at the end, would there only be one nurse, you would have to grab another
one of the
provider or
providers
extra, whoever has a license.
to count
Something
down
to
with
lose,
you. Yeah,
basically.
something to lose so that you don't have one person counting the narcotics without somebody else watching.
Exactly.
So at the end of each shift, we make sure that they're either been used or they're still there.
Right.
Right.
Everything's
Okay.
accounted for.
Right. And so is there any kind of, so when you order them, we order them from several different sources. Is there any special thing other than the triplicate that has to be done when you order from a manufacturer, or any sort of regulations they make us follow or anything? You just we order 50,000 of them, or is there limits, or how does it work?
No, I mean, there are limits.
As to how many at a
Right.
time you can do and that kind of
Right.
thing? Okay. All right, so basically, we keep a lockbox, let me make sure I understand this, keep a lockbox double locked in a locked room in a low traffic area ideally.
Mm-hmm.
We order them based on the state's regulations, triplicate prescription, etc., and then we follow DEA guidelines to keep it safe.
Right.
Okay. Anything else that we do in particular to help keep those things safe? Does that pretty much sum it up?
As much as it up, just
Okay.
everything's logged and then, double counted.
Which things do we keep in the lock safe? Pretty much all Schedule 2s?
All Schedule 2 and 3s, every narcotic.
Also Schedule
All
3s?
narcotics.
So all Schedule 3s, all Schedule 2s?
And anything that's in a cold box has to be in a lockbox in a refrigerator.
So 2 separate lock boxes, one in the outside the refrigerator, one inside the refrigerator. But the refrigerator itself doesn't have to be locked.
No.
Okay, all right, good. All right, so now you're supposed to ask me some questions.
I am.
I know, I'm excited.
Yeah.
I'm pretty excited. Nobody ever asked me questions on this thing.
Right. One of the things we started at our Texarkana location, one of our Texarkana locations, Healthcare Express, is a new pain management clinic.
We have.
Why did we decide to do this?
Well, we have a kind of a unique situation in that community in that we have a group of customers or patients who were coming to us asking for pain management. This is more chronic, sort of outside what we would normally do in urgent care, and having chronic pain management. The unique thing that is in that community versus some communities is there's really nowhere else for them to go.
Right.
There's no good chronic pain management clinics. There's nobody doing that in our community and nobody taking care of that. And so we were kind of in a dilemma for a while. We were helping them, but at the same time we felt maybe that's really not our niche. It's not what we do. We're supposed to be an urgent care center. And so we really argued with ourselves as to the right thing to do for the patient and the right thing to do for the business and what we felt comfortable with.
Right.
And so finally, after having many meetings and talking about it, what we decided to do was set one day aside with one doctor who had an interest in that and one of our PAs who have an interest in that and set it up and do it correctly. And by correctly, I mean we actually went to the board. We actually called the board and went through their guidelines and set it up exactly how their recommendations of what procedures should be followed, what paperwork should be followed. As you know, it's lengthy and long.
Right.
And actually forced patients to go into that process. We're in the process of doing that now, so that we can weed out anybody who might be lying or drug seekers or those kinds of things, and make them go through the process. Actually make it somewhat difficult to get into
Right.
the process. And now we've got a process now that's very well run. So they see the same provider every time. They have certain rules they have to follow. There's certain paper that's documented, and it's sort of taken the scary part, I guess, if you want to say it, seeing different people and should we do this or should we not do that. So I think it was unique to that community and that facility because we had that opportunity. The business side of it, tough decision. Do we really want to be in that business? Do we not want to be in that business? But at the end of the day, we decided, this is a need that needs to be served, and so we serve it.
Okay. Would you recommend it to new opening clinics?
Absolutely not.
What about established clinics?
I think it depends on the need in your community. I think the reason I wouldn't recommend it to new clinics is it's very hard and it was a long process. You have to have a lot of resources already in place.
Right.
If we didn't already have the resources that we had, it would have been very difficult to do. So I wouldn't recommend it for new clinics. If you have an established clinic, I think it really kind of depends on, number one, the interest of your physician, because you have to have a physician who's interested in that. And secondly, the need of your community. If you already have great pain management clinics that exist in your community already, and you got a good referral source for them and you send them to them, I think that's fine. If you don't, and you have the resources, it certainly is worth considering. It's certainly something we could have a conversation with somebody about who is interested in doing. So that's how I feel.
All right. Sounds good.
You look beautiful married.
Thank you.
Thank you for your time.
Thank you.
Bye.